Hello everyone. Today's topic is on Rybelsus. This is Rybelsus, or oral semaglutide. It is a glucagon-like peptide 1 receptor agonist, indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus. It comes in different doses, strength of 3, 7, or 14 milligrams. Semaglutide was discovered in 2012 as a longer-acting alternative to liraglutide in diabetic patients. It was approved by the FDA in 2017 as the injection-type drug under the trade name Ozempic. Even so, almost all GLP-1 receptor agonist drugs marketed so far are in injectable peptide formulations. Therefore, Rybelsus was later worked on and approved by US FDA in 2019 as the first oral-type drug formulation of the analog of human GLP-1 semaglutide. Rybelsus is formulated for type 2 diabetes mellitus, a metabolic condition where the body gradually loses the capacity to produce enough insulin in the pancreas, or becoming insulin resistance. It will lead to chronic hyperglycemia. In clinical pharmacology, the chemical structure of GLP-1 analog influence in the extension of the drug's half-life. In the drug mechanism of protraction, the long half-life of semaglutide is due to stabilization from the DPP-4 degradation at position 8, and also the presence of strong albumin binding due to long chain, which results in decreased renal clearance and protection from metabolic degradation. How does this drug works? Oral semaglutide acts as a GLP-1 receptor agonist that selectively binds to and activates the GLP-1 receptor, the target for native GLP-1. Noted that GLP-1 is a physiological hormone that has multiple actions on glucose, mediated by the GLP-1 receptors. Activation of GLP-1 reduces fasting and postprandial blood glucose through a mechanism where it stimulates insulin secretion and lowers glucagon secretion, both in a glucose-dependent manner. Thus, when blood glucose is high, insulin secretion is stimulated, and glucagon secretion is inhibited. GLP-1 receptor agonists also delay postprandial gastric emptying. How does Rybelsus approved by FDA? First, there are a series of preclinical studies conducted using human gastric NCLN87 cell line, Wistarhon IGS mice, Sprague-Dawley rat, and cynomolgus monkey to study pharmacology, pharmacokinetics and toxicity of Rybelsus. Pharmacology studies aim to elucidate how SNAC enhances the absorption of Rybelsus in the gastrointestinal tract. From the studies, SNAC exerts buffering actions in the stomach, and it can be weakened after dilution by food or liquid. The transport of semaglutide is mediated via the transcellular route. Pharmacokinetics studies with oral semaglutide plus SNAC showed a low oral bioavailability, a more variable systemic exposure, more rapid excretion, compared to parenteral dosing. Toxicology studies show that the drug was generally well tolerated. No local toxicity in the gastrointestinal tract, and antibodies against semaglutide were observed. The no observed adverse effect level, NOAEL, determined, is 20 mg per kilogram per day. It is noticed that high doses of the enhancer SNAC were associated with mortality. After preclinical research, the tests of drug go through a series of clinical trials. In phase 1 of clinical trial, there is a study aimed to investigate on safety, tolerability and pharmacokinetics of multiple doses of Rybelsus in healthy and type 2 diabetes male subjects. It is a randomized, double-blinded, and parallel group trial, which performed for 10 weeks, involving 107 male healthy volunteers and type 2 diabetes patients. The intervention is Rybelsus and placebo. From the findings, Rybelsus was suitable for once-daily dosing, as it is well tolerated by trial subjects. So, it is safe to proceed to Phase 2. Phase 2 trial investigates dose range, escalation, and efficacy of oral semaglutide in subjects with type 2 diabetes. This is a 26 weeks trial, with 5 weeks follow-up, at 100 sites, in 14 countries conducted. In this trial, 632 type 2 diabetics patients are randomized, and parallel grouped into different dosage of oral semaglutide, placebo, or subcutaneous semaglutide. The mean change in hemoglobin A1c level, from baseline to week 26 was compared, and showed oral semaglutide resulted in better glycemic control than placebo over 26 weeks. These findings support Phase 3 studies to assess longer-term and clinical outcomes, as well as safety. A global clinical program, called Pioneer, which included 10 well-conducted randomized, double-blind, international, multi-center Phase 3 clinical trials. Pioneer 1 investigates the monotherapy use of Rybelsus in type 2 diabetics patients. In a 26-week double-blind trial, 703 type 2 diabetics patients were randomized to Rybelsus of 3, 7, or 14 mg once daily, or placebo. The monotherapy with Rybelsus resulted in a statistically significant reduction in hemoglobin A1c. Pioneer 2, 3, 4, 7 and 8 investigate the efficacy of Rybelsus versus comparator treatment. To conclude, Rybelsus is superior to empagliflozin, sitagliptin, and placebo, and non-inferior to liraglutide, to reduce hemoglobin A1c level. Pioneer 5 investigate the efficacy and safety of oral semaglutide in patients with type 2 diabetes and moderate renal impairment. The patients involved in this trial have an estimated glomerular filtration rate of 30 to 59 ml per minute per 1 ml. 73 meters square. The result shows oral semaglutide was effective in patients with type 2 diabetes and moderate renal impairment. Pioneer 6 is a trial investigating the cardiovascular safety of oral semaglutide in subjects with type 2 diabetes. The trial involved patients at high cardiovascular risk. 16 months of study show the result that there is no increased risk for major adverse cardiovascular event with Rybelsus. And next, the Phase 4 of clinical trial is also known as post-marketing surveillance. Currently, there is no available data of this phase for Rybelsus. Lastly, the common adverse effect observed from all the controlled Phase 3A trials are hypoglycemia, gastrointestinal disorders, increased heart rate, and eye disorders. That is all about Rybelsus. Thank you.